Nationals and non-nationals traveling to Guyana from certain countries in Africa, including Nigeria and the Democratic Republic of Congo, Mali, and others where there is an outbreak of the deadly yellow fever, are required to be vaccinated against yellow fever before traveling here.
Yellow fever also has a high mortality rate. About a third of persons who are infected die. So it's just as dangerous as Ebola, for example.
Chief Medical Officer at the Ministry of Public Health, Dr. Shamdeo Prasad. For persons who would have entered the country from worst hit countries without the vaccine, there are measures that will be taken.
For you to develop immunity with a vaccine, you have to have the vaccine at least 10 days prior to being here. So we cannot say that the vaccine has been effective. We'll still need to put such a person on quarantine. We can offer the vaccine, but we still need to put such person on quarantine. Once we can observe them for 6 days and ensure that they didn't develop any of the signs and symptoms of yellow fever, then that person will be free to conduct whatever business.
Medical authorities are hoping that all precautions can be taken to prevent yellow fever from spreading astronomically here. Persons within recent weeks have been flocking the Ministry of Public Health in the city.
Because they don't have records mostly. So if they can't produce those records, then we have to revaccinate them. So we have actually been using up our vaccines quite rapidly, giving people who have already been immunized. All right. And some people say they've had 3-4 vaccines already.
But already, there is a global shortage of the vaccine, according to the Chief Medical Officer.
We are really being conservative and reserving those vaccines absolutely for the people who never had a vaccine or for those who are traveling to the endemic countries.
There is no outbreak in countries like Trinidad, Suriname, and other South American countries, but they are listed as risk countries. According to the World Health Organization, symptoms of yellow fever include fever, headache, jaundice, muscle pain, nausea, vomiting, and fatigue. It is a virus which is endemic in tropical areas of Africa and Central and South America. A single dose of the yellow fever vaccine is sufficient to confer sustained immunity and lifelong protection against yellow fever, and a booster dose of the vaccine is not needed. The virus is transmitted by mosquitoes belonging to the Aedes and Haemogomus species. Handel Duncan, HGP Nightly News.